I would consider the Phone-a-thon an overwhelming success. To this date, we're still receiving an unbelievable amount of calls each and every day in response to the outreach that the helpline and the outreach manager has done at Healthcare for All.
I thought the Phone-a-thon was a fantastic event. It allowed us as an organization to do the personal work with consumers that some of us in positions that are outside of the helpline don't have an opportunity to do on a day-to-day basis.
I think it was a success. We were able to reach certain groups of people. We were able to connect with some of them. So I think it was a success.
I think it was a good experience from my point of view because I never experienced before something like was a lot of people that they were trying to call us, trying to get help, and not just help for them, help for their children, and I think that was very important for me.
It was amazing to see so many people from different backgrounds coming together to make a difference in children's lives. The energy of the day was incredible. Communications were happening across 3 different languages all at once. Other stories were just feeding our desire to continue to do the work that we have been doing. Families were sharing with us that they lost their jobs and lost their health insurance with it. Families were calling us and sharing that they have been praying that their kids don't get sick because they wouldn't be able to take them to the doctor, because they wouldn't be able to afford it.
So the story I remember most from Phone-a-thon is a 19-year-old youth who was calling to get himself health coverage. And I think what affected me most about that was that he wasn't living with his family and he did not have a permanent address. He was essentially homeless. And I'm glad that this is one piece of his life that is going to be secure.
The most beautiful experience that I have in this Phone-a-thon, it was when a teenager, he called me and to enroll the whole family. So he was the only income in the family, and also he took his break time to call us, and he called me so many times, and finally he get through. He told me all the story, and that really hurt me. So it really touched me, and I think that was one of the cases when I said, wow, I think we are doing a great job here in Healthcare for All.
Last call, we call her back, and we review the insurance was for her daughter, actually. They had no insurance whatsoever. She's 4 years old, so she was eligible. We expect her to get insurance.
I just had a caller. He's a father of 2 children, and he and his wife are both working, but they have had a lot of struggles throughout the past few years, and he was really appreciative of our help, and basically was saying, God bless you and thank you so much for what you've done for us, because he's really had a great deal of stress regarding the health of his family.
Let folks know every child in the state of Massachusetts should have health care coverage, because we have free and lower cost affordable options for kids that are available to every child in the Commonwealth.